The ambulance sirens pierced through the midnight air as paramedics rushed a man into Memorial General Hospital. His face was pale, breathing shallow, and his expensive suit was torn and bloodied from the motorcycle accident. What nobody knew, at that moment, was that this unconscious stranger would change everything for one dedicated nurse who was already 18 hours into what should have been a normal shift. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. The fluorescent lights of Memorial General's emergency department buzzed overhead as Maya Rodriguez adjusted her stethoscope and glanced at the clock. 11:47 p.m. She'd been on her feet since 6 a.m., covering for a colleague who'd called in sick with the flu. The double shift was taking its toll, but Maya had never been one to leave when people needed help. The emergency department was unusually busy for a Tuesday night. 3 car accidents, 2 overdoses, and a kitchen fire had kept the entire staff running non-stop. Maya's scrubs were wrinkled, her ponytail had come loose hours ago, and her coffee had gone cold for the 3rd time. But she pressed on with the same careful attention she gave every patient. Maya, incoming trauma in Bay 4, called Dr. Patricia Williams, the head of emergency medicine. Motorcycle versus semi-truck on Highway 101. Male, approximately 35, unconscious with possible internal bleeding. Maya nodded and quickly prepared the trauma bay. She'd handled hundreds of similar cases during her 8 years at Memorial General, but something felt different about this one. Maybe it was the exhaustion, or maybe it was the way the paramedics seemed more tense than usual as they wheeled the patient in. The man was unconscious, his dark hair matted with blood, wearing what appeared to be an expensive motorcycle jacket that was now shredded. His helmet had probably saved his life, but the impact had been severe. Maya immediately got to work, checking vitals, starting IV lines, and assisting Dr. Williams with the initial assessment. Possible internal bleeding, definite concussion, and his blood pressure is dropping, Dr. Williams announced grimly. We need to get him to surgery immediately, but OR3 is backed up for at least 2 hours. Maya looked at the monitors showing the patient's declining vitals. 2 hours might be too long. What about stabilizing him here while we wait, she suggested, already calculating the medications and procedures they'd need. It's risky, but it might be our only option, Dr. Williams replied. I'll need someone to monitor him constantly. Maya, I know you've been here all day, but I'll stay with him, Maya interrupted without hesitation. Whatever it takes. The next several hours became a blur of controlled chaos. Maya positioned herself at the patient's bedside, monitoring every breath, every heartbeat, every subtle change in his condition. She adjusted IV drips, administered medications, and documented everything meticulously while keeping a constant eye on his vital signs. Around 2 a.m., his blood pressure began to drop dangerously low. Maya immediately called for Dr. Williams, but she was in the middle of another emergency surgery. The nearest available doctor was 20 minutes away, dealing with a multi-car accident that had just arrived. Maya found herself alone with a patient whose life was literally in her hands. She'd been in similar situations before, but never after being awake for over 20 hours straight. Her hands trembled slightly as she checked his pulse, but her mind remained sharp and focused. The patient's breathing became more labored, and his skin grew cold and clammy. Maya recognized the signs immediately. He was going into shock. Without hesitation, she increased his IV fluids, adjusted his position to improve circulation, and began the delicate process of stabilizing him using every technique she'd learned in nursing school and refined through years of experience. For the next 45 minutes, Maya worked alone, making split-second decisions that would normally require a doctor's approval. She monitored his blood oxygen levels, adjusted medications, and even performed a procedure she'd only done a handful of times before to help with his breathing. Every few minutes, she checked the clock, hoping the operating room would become available soon. At 3:15 a.m., the patient's eyes fluttered open for the first time. He was disoriented and tried to sit up, but Maya gently placed a hand on his shoulder. "Easy there," she said softly. "You've been in an accident. You're at Memorial General Hospital and you're going to be okay. My name is Maya and I'm your nurse." The man's eyes focused on her with difficulty. What happened?" he whispered, his voice hoarse. "Motorcycle accident on Highway 101, Maya explained while checking his pupils with a small flashlight. "You've got a concussion and some internal injuries, but we're taking good care of you. How are you feeling?" He winced as he tried to move. "Like I got hit by a truck," he managed, attempting a weak smile. "Actually, it was the other way around," Maya replied, returning his smile. "You're lucky to be alive? What's your name?" "Marcus," he said after a moment. "Marcus Chen." Maya made a note on his chart. "Well, Marcus Chen, you gave us quite a scare tonight. We're going to get you into surgery as soon as possible, but right now I need you to stay still and let me take care of you." For the next hour, Maya stayed by Marcus's side, monitoring his condition and keeping him comfortable. She noticed he didn't ask about calling anyone, no family, no friends, no one to notify about the accident. When she gently inquired, he simply said he preferred to handle things himself once he was feeling better. Despite his injuries, Marcus was alert and surprisingly easy to talk to. He asked thoughtful questions about his treatment and seemed genuinely interested in Maya's work as a nurse. There was something about him that seemed different from most patients, a quiet intelligence and a way of listening that made Maya feel like he truly heard what she was saying. "You've been here all night," Marcus observed during one of their conversations. "Shouldn't your shift have ended hours ago?" Maya shrugged. "I don't leave until my patients are stable. Besides, you need someone to keep an eye on you." "You probably have a family waiting at home," Marcus said quietly. "Just my cat, Mr. Whiskers," Maya replied with a tired laugh. "He's probably wondering where his breakfast is, but he'll survive." At 4:30 a.m., Dr. Williams finally appeared with news that the operating room was ready. As the surgical team prepared to take Marcus away, he reached out and gently took Maya's hand. "Thank you," he said, his voice filled with genuine gratitude. "I don't know what would have happened if you hadn't been here." Maya squeezed his hand reassuringly. "That's what we're here for. You're going to do great in surgery, and I'll check on you afterward." As they wheeled Marcus toward the operating room, Maya finally allowed herself to sit down for the first time in hours. Her feet ached, her back was stiff, and she could feel the exhaustion settling into her bones. But there was also a sense of satisfaction that came from knowing she'd made a difference when it mattered most. The surgery lasted 3 hours. Maya had finally gone home to shower and feed Mr. Whiskers, but she returned before her next scheduled shift to check on Marcus's recovery. She found him awake in the ICU, looking much better despite the bandages and medical equipment surrounding his bed. "Maya," he said, his face lighting up when he saw her. "I was hoping you'd come by." "How are you feeling?" she asked, pulling up a chair beside his bed. "Like a new person, thanks to you," Marcus replied. "The surgeon said you probably saved my life last night. If you hadn't stabilized me when you did—" Maya waved off the compliment. "I just did my job." "No," Marcus said seriously. "What you did was extraordinary. I've been thinking about it all morning, and I realize I don't know anything about you except that you're the most dedicated nurse I've ever met." Over the next few days, as Marcus recovered, Maya found herself looking forward to checking on him. During her rounds, he was unlike any patient she'd encountered, thoughtful, curious about her life and work, and surprisingly knowledgeable about a wide range of topics. He never mentioned his job or his life outside the hospital, but there was something about his perspective that suggested he understood the world in ways that went beyond his years. By Thursday morning, Marcus had been moved from the ICU to a regular room on the 4th floor. Maya wasn't assigned to that ward, but she made it a point to visit during her breaks. She told herself it was just good patient follow-up, but truthfully, she enjoyed their conversations more than she cared to admit. "You know, I've been in hospitals before," Marcus said, as Maya checked his chart during one of her unofficial visits. "But I've never met anyone quite like you." Maya raised an eyebrow. "Oh, really? And what's that supposed to mean?" "Most people see this uniform, this job, and they make assumptions," Marcus explained, gesturing toward his hospital gown. "They either treat you like you're helpless, or they act like they're doing you a favor just by being polite. You treat everyone the same way, with genuine respect." "That's because everyone deserves respect," Maya replied simply. "Doesn't matter. If you're a CEO or homeless, when you're in that hospital bed, you're just someone who needs help." Marcus studied her face carefully. "Have you always wanted to be a nurse?" Maya sat down in the visitor's chair, something she rarely did during patient visits. "Actually, I wanted to be a doctor originally. I had grades, ambition, everything, but life had other plans." "What happened?" "My mom got sick when I was in pre-med," Maya explained, her voice growing softer. "Cancer. I dropped out to take care of her and help with the medical bills. By the time she passed, I couldn't afford to go back to medical school. Nursing school was more practical." "Do you regret it?" Maya considered the question. "Sometimes I wonder what might have been, but then I realize that as a nurse, I actually get to spend time with patients. I get to be there during the scary moments, the breakthrough moments, the healing moments. Doctors are brilliant, but they're often too busy to really connect. I wouldn't trade that for anything." Marcus nodded thoughtfully. "Your mother would be proud of who you became." Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. The comment caught Maya off guard. Most people offered empty condolences when she mentioned her mother's death, but Marcus seemed to understand something deeper about loss and purpose. Over the next few days, Maya learned more about Marcus in fragments. He mentioned traveling frequently for work, but was vague about the specifics. He spoke knowledgeably about technology and business trends, but deflected questions about his own career. He had no visitors except for a well-dressed woman who stopped by briefly on Friday afternoon. His assistant, he explained, handling some paperwork. What struck Maya most was how Marcus treated the hospital staff. He learned everyone's names. From the janitors to the specialists, he thanked people genuinely and asked about their families. When the young orderly, Tommy, mentioned struggling to pay for his textbooks, Marcus quietly arranged for the hospital's education fund to cover them, though he asked Tommy not to mention where the suggestion came from. "You're full of surprises," Maya commented after witnessing Marcus's kindness to Tommy. "Most patients are so focused on their own problems, they barely notice the people helping them." "I notice everything," Marcus replied, "especially people who go above and beyond without expecting anything in return." By Sunday, Marcus was scheduled for discharge. His recovery had been remarkable, faster than anyone expected. Maya found herself feeling oddly sad about his departure, which was unusual for her. She maintained professional boundaries with patients, but Marcus had somehow become more than just another case. "I wanted to thank you properly before I leave," Marcus said when Maya stopped by his room Sunday morning. "You already have, multiple times," Maya replied, reviewing his discharge instructions. "No, I mean really thank you. What you did that first night, staying with me, making those critical decisions when no one else was available, that was extraordinary." Maya felt her cheeks warm. Any nurse would have done the same thing. "That's not true, and you know it," Marcus said firmly. "You saved my life, Maya, not just medically, but in ways you probably don't even realize." Before Maya could ask what he meant, Dr. Williams appeared with the final discharge paperwork. Marcus signed everything quickly, and soon it was time for him to leave. "Will you keep in touch?" Marcus asked as he gathered his few belongings. Maya hesitated. She'd never maintained contact with former patients before. I don't really do that. Professional boundaries and all." Marcus pulled out a business card and wrote something on the back. "I understand, but if you ever need anything at all, please don't hesitate to call." Maya took the card without looking at it, slipping it into her pocket. "Take good care of yourself, Marcus, and please wear a helmet if you get another motorcycle." Marcus laughed. "Actually, I think I'm done with motorcycles for a while. Maybe I'll stick to cars from now on." After Marcus left, Maya felt a strange emptiness. The hospital seemed quieter somehow, less interesting. She threw herself into her work, picking up extra shifts and focusing on her other patients, but something had changed. It wasn't until Tuesday evening, when she was doing laundry at home, that she remembered the business card. She pulled it from her pocket and looked at it for the first time. The card was elegant, heavy stock with minimal text. Marcus Chen, founder and CEO, Innovate Tech Solutions. Below that was a phone number and email address. On the back, in Marcus's handwriting, were the words, "For the person who reminded me what true compassion looks like. Thank you for everything." Maya stared at the card, her mind racing. Innovate Tech Solutions. She'd heard that name before, but couldn't place it. Curious, she opened her laptop and did a quick internet search. The first result made her drop the business card. Innovate Tech Solutions was one of the fastest-growing technology companies in the country, specializing in healthcare innovation and medical devices. The company was valued at over $3 billion, and its founder and CEO, Marcus Chen, was featured on the cover of tech magazines regularly. Maya scrolled through article after article, her amazement growing with each headline. Tech Visionary. Marcus Chen revolutionizes healthcare. From startup to empire, the Marcus Chen story. Billionaire CEO pledges half his fortune to medical research. The photos showed the same man she'd spent hours talking to in the hospital, but dressed in expensive suits and speaking at conferences to thousands of people. In every image, he looked confident, successful, and completely different from the vulnerable patient she'd cared for. Maya sat back in her chair, overwhelmed. She'd treated one of the most successful entrepreneurs in the country like any other. Patient, never knowing who he really was. More importantly, he'd let her. He could have revealed his identity, could have demanded special treatment or private rooms, but instead he'd chosen to be just Marcus, a person who needed help. Her phone buzzed with a text from her colleague Jennifer. "Did you see the news about the hospital? Some anonymous donors just gave Memorial General $10 million for a new emergency wing. They want to call it the Compassionate Care Center. Crazy, right?" Maya stared at the message, then at Marcus's business card, then back at her laptop. Screen showing his photo. A slow smile spread across her face as the pieces began to fall into place. She picked up her phone and started typing a message, then stopped. "What do you say to someone who just donated $10 million to your hospital? Someone who'd experienced your care at its most genuine and decided to give back in an extraordinary way." Instead, she saved his contact information and simply sent, "Thank you for reminding me why I love what I do. I hope you're healing well. Maya." The response came back within minutes. "Thank you for showing me what true healing looks like. Would you be free for coffee this weekend? I have a proposition that might interest you." Maya stared at the message, her heart racing with possibilities she couldn't yet imagine. Maya spent the entire weekend wondering what Marcus's proposition could be. She'd agreed to meet him at a small cafe downtown, choosing a place far from the hospital where she wouldn't run into colleagues. Part of her was nervous about seeing him outside the medical setting, where she'd always felt in control. The cafe, Roasted Dreams, was quiet on Sunday afternoon. Maya arrived 10 minutes early, ordering a simple coffee and choosing a corner table where they could talk privately. She'd changed clothes 3 times that morning, finally settling on jeans and a casual blouse. Professional, but not too formal. Marcus walked in exactly on time, and Maya was struck by how different he looked. Gone was the vulnerable patient in a hospital gown. Instead, he wore dark jeans, a navy sweater, and expensive-looking sneakers. He moved with quiet confidence, but his smile was the same warm expression she remembered from their hospital conversations. "Maya," he said, approaching her table, "thank you for agreeing to meet me. I have to admit I'm curious about this proposition," Maya replied, as Marcus sat down across from her. "First, I owe you an explanation," Marcus said, signaling the waitress. "For coffee. I know you figured out who I am," Maya nodded. "The $10 million donation to Memorial General was a pretty big clue." Marcus smiled sheepishly. "I was hoping to be more subtle about that. Why didn't you tell me while you were in the hospital?" "Honestly, because it was refreshing to be treated like a normal person," Marcus explained. "Do you know how long it's been since someone talked to me without wanting something, without calculating what they could gain from the conversation? You saw me at my most vulnerable and you just helped. No agenda, no expectations." Maya studied his face. "But you do want something now, don't you? That's why we're here." "I want to offer you something," Marcus corrected. "But first, tell me about your dream job. If money and circumstances weren't factors, what would you be doing?" The question caught Maya off guard. "That's random." "Humor me." Maya thought for a moment. "I'd probably run some kind of clinic in an underserved community, somewhere people could get quality healthcare, regardless of their ability to pay. I'd like to focus on preventive care, education, and helping people before they end up in emergency." "Rooms. What's stopping you?" "Reality," Maya laughed. "Clinics need funding, equipment, staff, insurance, legal compliance. I make decent money as a nurse, but not nearly enough to start something like that." Marcus leaned forward. "What if I told you I've been working on a project that addresses exactly those issues?" "I'd say you're about to make me an offer I should probably refuse." "Innovate Tech has been developing a new model for community healthcare," Marcus explained. "We've created portable diagnostic equipment, telemedicine platforms, and streamlined record-keeping systems that can bring high-quality medical care to areas that don't have traditional hospitals or clinics." Maya's interest was piqued despite her caution. "Sounds expensive." "Technology exists. What we need is someone who understands healthcare from the ground up, someone who knows what patients actually need versus what administrators think they need, someone who can help us implement these solutions in real communities. And you think that someone is me?" "I know it is," Marcus said firmly. "Maya, I've been in hundreds of hospitals around the world. I've met countless healthcare professionals. What you did for me wasn't just good nursing. It was intuitive, compassionate care that came from truly understanding what healing requires." Maya felt her skepticism rising. "Marcus, I appreciate the confidence, but I'm not a business person. I don't know anything about running healthcare technology companies." "You don't need to. I have plenty of people who understand business. What I need is someone who understands people." The waitress refilled their coffee cups, giving Maya a moment to process. "What exactly are you proposing?" "I want you to lead our new community health initiative. You'd work with our development teams to design and implement pilot programs in underserved areas. You'd have a budget, a team, and complete autonomy to create the kind of healthcare access you just described." Maya nearly choked on her coffee. You're offering me a job? Just like that? I'm offering you the opportunity to make the impact you've always wanted to make, but on a scale you never imagined possible. I don't have an MBA. I don't have executive experience. I've never managed anything bigger than a nursing shift. You managed to save my life when you were running on no sleep after 20 hours of work, Marcus pointed out. You made life or death decisions under pressure and got them right. That's the kind of judgment I need. Maya shook her head. This is crazy. You barely know me. I know enough. I know you chose nursing over medicine to take care of your mother. I know you stayed with a stranger all night because it was the right thing to do. I know you treat janitors and surgeons with the same respect. I know you've never asked me for anything, even after you found out who I am. What about my job at Memorial General? I can't just abandon my patients. You wouldn't be abandoning anyone. You'd be helping create a system where more people get the kind of care you provide. Think about it. Instead of helping one patient at a time, you could help design programs that serve thousands. Maya felt overwhelmed. This is all happening too fast. A week ago, you were my patient. Now you're offering to change my entire life. I understand it's a lot to process, Marcus said gently. I'm not asking for an answer today, but I am asking you to consider the possibility that maybe this accident brought us together for a reason. You don't believe in fate, do you? Marcus smiled. I believe in recognizing opportunities when they present themselves, and I believe in backing people who have the passion and integrity to make a real difference. What would this job actually look like day to day? Initially, you'd spend time with our development teams, helping them understand the real-world challenges of healthcare delivery. Then you'd identify communities where we could implement pilot programs. You'd work with local healthcare providers, community leaders, and our technical staff to design solutions that actually work for the people who need them. And the salary, $200,000 to start, plus equity in the company, full benefits, and a budget for your programs that's substantial. Maya's eyes widened. She currently makes $68,000 a year at the hospital. Marcus, that's more than 3 times what I make now. It's not about the money, Maya. It's about what you can accomplish with the resources to match your vision. They sat in silence for several minutes, Maya staring into her coffee cup, while Marcus waited, patiently. Can I ask you something? Maya finally said. Anything. Why healthcare? You could make money in any tech sector. Why focus on something so complicated and regulated? Marcus's expression grew serious. My grandmother died when I was 12 because she couldn't afford her insulin. She was diabetic, but she kept rationing her medication to make it last longer. By the time my family realized what was happening, it was too late. I'm sorry. That's when I decided that if I ever had the resources to make a difference, I'd focus on making healthcare accessible to people like her, people who deserve better, than a system that prioritizes profit over care. Maya felt something shift inside her. This wasn't just a business opportunity. It was a chance to be part of something meaningful. If I were to consider this, she said carefully, I'd want to make sure we're really helping people, not just creating feel-good publicity for your company. Agreed. In fact, I'd insist on it. We're not doing this for publicity. We're doing this because it's the right thing to do. And I'd want to stay involved in direct patient care somehow. I don't want to become completely disconnected from the people we're trying to help. That could definitely be arranged. Maya took a deep breath. I need to think about this. And I'd want to research your company more, talk to some of your current employees, and understand what I'd really be getting into. Of course, take all the time you need. Marcus pulled out his phone. I'm going to give you the contact information for Dr. Sarah Martinez. She's our Chief Medical Officer and runs our current healthcare initiatives. She can answer any questions about the work itself. Dr. Martinez? I think I've read her research papers. She's brilliant. And she started her career as an ER nurse before going to medical school. I think you two would work well together." As they prepared to leave the cafe, Marcus handed Maya a folder she hadn't noticed him carrying. "What's this?" "Information about some of the communities we're considering. For pilot programs. Take a look when you get home. See if any of them speak to you." Maya accepted the folder, feeling its weight both literally and figuratively. "Marcus, can I ask you one more thing?" "Sure. If I hadn't been your nurse that night, would you still be offering me this job?" Marcus considered the question seriously. "Honestly, probably not, but not because you wouldn't be qualified, because I never would have met you. Sometimes the most important opportunities come from the most unexpected places." As Maya drove home, her mind raced with possibilities and doubts in equal measure. The folder sat on her passenger seat like a doorway to a completely different future. Maya spent Monday morning at work distracted, the folder from Marcus sitting unopened on her kitchen table. Every time she looked at a patient's chart or helped someone through a difficult moment, she found herself imagining what it would be like to design systems that could help hundreds or thousands of people at once. During her lunch break, she called her best friend Jessica, a social worker who'd known her since nursing school. "So let me get this straight," Jessica said, after Maya explained the situation. "The patient you saved turned out to be a billionaire, and now he wants to hire you to run healthcare programs?" That's the simplified version, but yes. "Maya, this sounds like something out of a movie. Are you sure this isn't some elaborate scam?" I looked him up extensively. Marcus Chen is definitely real, and Innovate Tech is definitely legitimate. I even called the hospital's development office. They confirmed the $10 million donation came from his company. Okay, so he's legit. But honey, you've been a floor nurse your entire career. This is like jumping from community theater to Broadway. Maya had been thinking the same thing. Maybe that's exactly why I should do it. When will I ever get another chance like this? Or maybe you should be asking why a billionaire CEO thinks a hospital nurse can run a multi-million-dollar initiative. That evening, Maya finally opened the folder Marcus had given her. Inside were detailed profiles of 5 communities across the country that lacked adequate healthcare access. Rural farming towns, urban neighborhoods where the nearest hospital was hours away, Native American reservations with limited medical facilities. Each profile painted a picture of people who needed exactly the kind of help Maya had always wanted to provide. One profile particularly caught her attention. Millbrook, a former mining town in West Virginia with a population of 3,200. The nearest hospital was 90 minutes away, and the town's only clinic had closed 2 years earlier, when their doctor retired. The profile included interviews with residents who described driving hours for basic medical care, rationing medications, and avoiding treatment until emergencies forced them to seek help. Maya found herself making notes in the margins, thinking about how portable diagnostic equipment could help, how telemedicine could connect residents with specialists, how preventive care programs could address the most common health issues before they became crises. By the time she finished reading, it was past midnight, and she realized she'd been unconsciously planning implementation strategies. Maybe Jessica was wrong. Maybe this wasn't about credentials or experience. Maybe it was about vision and genuine care for people's well-being. The next morning, Maya called Dr. Sarah Martinez. Their conversation lasted over an hour, covering everything from Innovate Tech's current projects to the challenges of implementing healthcare technology in underserved communities. "Marcus told me about your background," Dr. Martinez said. "I have to admit, when he first suggested hiring a floor nurse to lead this initiative, I was skeptical. But after hearing your questions and ideas, I think he might be onto something." "Can I ask you something honestly?" Maya said. "Do you think I'm qualified for this? Qualified in the traditional sense?" "Probably not. But qualification isn't just about degrees and titles. Some of our most successful programs have been led by people who understood the problems we were trying to solve, not just the technology we were using to solve them. What made you transition from nursing to your current role? Honestly, frustration. I got tired of treating the same patients over and over for problems that could have been prevented with better access to care. I went to medical school because I thought becoming a doctor would give me more influence. But it wasn't until I started working with technology companies that I realized the real leverage was in changing systems, not just treating individual cases. After the call, Maya felt more confident about the possibility. Dr. Martinez had offered to arrange visits to some of Innovatech's existing healthcare sites, and Maya found herself genuinely excited about the prospect. That afternoon, Maya requested a meeting with her supervisor at Memorial General, Patricia Williams. They'd worked together for 5 years, and Maya respected her opinion more than almost anyone's. "You want to leave nursing?" Dr. Williams asked after Maya explained the situation. "Not exactly. I'd still be working in healthcare, just from a different angle. Maya, you're one of our best nurses. Patients request you specifically, your colleagues trust your judgment, and you've never shown any interest in administration or management roles. This seems completely out of character. Maybe that's because I never had an opportunity like this before." Dr. Williams leaned back in her chair. "Can I speak to you as a friend, not just your supervisor?" Maya nodded. "I've seen good nurses get lured away by big salaries and fancy titles, only to end up miserable in corporate environments where they never interact with patients anymore. Are you sure that's not what this is?" "I've thought about that, but Marcus has specifically said I could maintain some direct patient contact. And honestly, Patricia, when I read about these communities that don't have any healthcare access, I realized I could help one person at a time here, or I could help design systems that serve thousands of people who currently have no options at all." Dr. Williams studied Maya's face carefully. "You're serious about this?" "I think I am." "What does your gut tell you?" Maya considered the question. "My gut tells me this is scary and uncertain and could be the biggest mistake of my life, but it also tells me that if I don't try, I'll always wonder what might have been." "That sounds like Maya Rodriguez logic," Dr. Williams said with a small smile. "When would you start?" "I haven't accepted yet. I want to visit some of their existing sites first, see what the work actually looks like." "Smart. And Maya, if you do this and it doesn't work out, you'll always have a place here." The following week, Maya used her vacation days to visit 2 Innovatech healthcare sites. The first was a mobile clinic program serving rural communities in Oregon. The second was a telemedicine center in inner-city Detroit that connected residents with specialists around the country. Both visits exceeded her expectations. The technology was impressive, but what struck Maya most was how the programs had been designed around patient needs rather than technological capabilities. She met nurses, social workers, and community health advocates who spoke passionately about the difference they were making in people's lives. In Oregon, she shadowed a nurse, a practitioner named David Kim, who ran the mobile clinic program. "Before this program started," David told her, "people in these communities would drive 4 hours to see a doctor, or more often they just wouldn't seek care at all. Now we bring comprehensive healthcare directly to them." Maya watched David examine patients, provide vaccinations, conduct health screenings, and coordinate care with specialists via video conference. The technology was seamless, but the approach was fundamentally about meeting people where they were and addressing their actual needs. In Detroit, she met with Maria Santos, who coordinated the telemedicine program. "We're not trying to replace traditional healthcare," Maria explained. We're trying to fill the gaps. When someone can't get time off work to spend a whole day at a specialist appointment, or when they can't afford transportation, we bring the specialist to them. Maya sat in on several telemedicine consultations, watching patients connect with cardiologists, dermatologists, and mental health counselors from their local community center. The relief on patients' faces when they could access care without the barriers they'd previously faced was unmistakable. By the end of her visits, Maya realized her perspective had fundamentally shifted. This wasn't about leaving nursing, it was about expanding what nursing could accomplish. On the flight home, she drafted her resignation letter to the Memorial General. Then she called Marcus. "I've made my decision," she said when he answered. "And? When? Do I start?" The excitement in Marcus's voice was unmistakable. "Are you sure?" "I'm terrified," Maya admitted, "but I've never been more sure of anything in my life. Welcome to Innovate Tech, Maya. I think you're going to change everything." As Maya hung up the phone, she felt a mixture of excitement and fear that reminded her of her first day of nursing school. She was about to step into a completely unknown world, but for the first time in years, she felt like she was moving towards something rather than just maintaining the status quo. Her phone buzzed with a text from Marcus. "Team meeting tomorrow at 9 a.m. Time to start changing the world." Maya's first day at Innovate Tech felt like stepping into another universe. The company's headquarters occupied 3 floors of a gleaming downtown building with floor-to-ceiling windows, modern art, installations and workspaces that looked nothing like any hospital she'd ever seen. Employees moved through the halls with laptops and tablets, engaged in conversations about algorithms, user interfaces, and market penetration strategies. Marcus met Maya in the lobby, looking every inch the tech CEO in a crisp white shirt and dark blazer. "Ready for the grand tour?" he asked, his warm smile helping to calm Maya's nerves. "As ready as someone can be when they have no idea what they're getting into," Maya replied. The tour began in the development labs, where engineers were working on the next generation of portable diagnostic equipment. Maya watched, fascinated, as a young programmer named Alex demonstrated a handheld device that could perform blood tests, EKGs, and basic imaging scans. "This single device can do what used to require a full laboratory," Alex explained enthusiastically. "We're basically putting a miniature hospital in a briefcase." "How accurate are the results?" Maya asked, immediately thinking about potential false positives or missed diagnoses. "That's exactly the right question," Dr. Martinez interjected, appearing beside them. "And it's why we need your expertise. The technology is impressive, but we need someone who understands the human side of healthcare to help us implement it properly." Next, they visited the data analytics department, where teams were developing algorithms to predict health trends and identify at-risk populations. The department head, a soft-spoken woman named Dr. Lisa Chen, showed Maya dashboards that could track everything from vaccination rates to chronic disease patterns across entire communities. "The goal isn't just to treat illness," Dr. Chen explained, "but to prevent it by identifying problems before they become crises. If we can predict where diabetes rates are likely to spike, we can implement prevention programs before people get sick." Maya found herself asking dozens of questions, her nursing background helping her identify potential issues the technologists hadn't considered. How would they handle patients who couldn't read? What about communities where people were suspicious of technology? How would they ensure that data collection didn't become a barrier to care? "See," Marcus said quietly as they moved between departments, "you're already thinking about problems we need to solve." The most impressive stop was the simulation center, where Innovate Tech tested their healthcare solutions in realistic environments. Maya walked through a mock rural clinic, a simulated emergency room, and even a recreation of a patient's home where telehealth consultations might take place. "We don't just build technology and hope it works," explained the simulation director, James Rodriguez. "We test everything in conditions as close to reality as possible. But we've learned that our biggest blind spot is understanding how patients actually behave in these environments." After the tour, Marcus led Maya to her new office. It was larger than her apartment, with a view of the city skyline and furniture that probably cost more than her car. On her desk was a stack of files, a top-of-the-line laptop, and a welcome gift, a small plant with a note from the entire healthcare team. "This feels surreal," Maya said, settling into her chair. "Yesterday, I was checking IVs and adjusting medication drips. Today, I have an office with a view. How are you feeling about everything?" Marcus asked, taking a seat across from her desk. "Overwhelmed, excited, terrified," Maya admitted, "but also energized in a way I haven't felt in years." Dr. Martinez knocked on the open door. "Sorry to interrupt, but I wanted to go over Maya's first few weeks while Marcus is here." For the next hour, they outlined Maya's initial schedule. She would spend time with each department, learning about their current projects and providing input from a clinical perspective. She would review the community profiles in detail and begin developing implementation strategies for the pilot programs. "We also want you to identify your own team," Dr. Martinez said. "You'll need clinical advisors, community liaisons, and project managers. Think about what kind of expertise you'll need and what kind of people you want to work with." "I have some ideas already," Maya said, thinking about colleagues from Memorial General who might be interested in joining the initiative. Marcus stood to leave. "One more thing, Maya. Don't try to do everything at once. This is a marathon, not a sprint. Take time to understand the landscape before you start making major changes." That evening, Maya called her friend Jessica to debrief about her first day. "It sounds amazing," Jessica said, "but also completely insane. Are you sure you know what you're doing?" "Absolutely not," Maya laughed. "But that's what makes it exciting. For the first time in my career, I'm being asked to think about healthcare from a completely different angle. What's your first priority?" Marcus suggested I start with the West Virginia community I read about, Millbrook. "I want to visit there personally, spend time with residents, and understand their needs before we design any solutions." "That sounds very Maya-like. When do you go?" "Next week. I'm nervous about it, but I think it's important to see the situation firsthand before I start making plans from a corporate office." The following Monday, Maya flew to Charleston, West Virginia, then drove 2 hours through mountainous terrain to reach Millbrook. The town was smaller than she'd expected, with a main street that couldn't have been more than 6 blocks long. Many of the storefronts were empty, and the few businesses that remained looked like they were struggling. Maya had arranged to stay at the town's only bed and breakfast, run by a woman named Helen Murphy, who had lived in Millbrook her entire life. Helen was in her 60s, with grey hair and sharp eyes that seemed to take Maya's measure immediately. "So you're the one from the technology company," Helen said, as she showed Maya to her room. "Word travels fast in a town this size." "I hope." "That's not a problem," Maya replied. "Depends on what you're really here for. We've had plenty of people come through promising to help, then disappearing when they realize there's no money to be made." Maya appreciated Helen's directness. "I'm here to listen and learn. I can't make any promises about what we can accomplish, but I can promise that I'm genuinely interested in understanding what this community needs." Over the next 3 days, Maya interviewed dozens of residents, from young families to elderly retirees. She visited the shuttered clinic, toured the volunteer fire department that served as the town's emergency medical service, and attended a town hall meeting where healthcare was the primary topic of discussion. The stories she heard were both heartbreaking and inspiring. Margaret Foster, a diabetic grandmother, described rationing her insulin because she couldn't afford the 3-hour round trip to refill her prescription every month. Tom Williams, a former miner with chronic lung problems, hadn't seen a specialist in 2 years because he couldn't take time off work for the lengthy hospital visits. But Maya also met people like Bobby Chen, a retired teacher who had organized an informal network of residents who checked on elderly neighbors, and Linda Davis, a former nurse who provided basic first aid and health advice from her kitchen table. "We take care of each other the best we can," Linda explained, "but there's only so much you can do without proper equipment and access to doctors." On her last evening in Millbrook, Maya sat with Helen on the bed and breakfast's front porch, watching the sunset over the mountains. "What do you think?" Helen asked. "Still want to help us?" "More than ever," Maya replied, "but I also realize how complicated this is going to be. It's not just about bringing in technology. It's about building trust, training people, and creating sustainable systems." "You sound like you actually get it," Helen said with approval. "Most outsiders think they can just drop some equipment, often solve all our problems. I was a nurse before this," Maya explained. "I've learned that the best healthcare happens when you really understand the people you're trying to help." Helen studied Maya's face in the fading light. "You know, when the clinic closed, a lot of people here gave up hope that anyone would ever care about our health problems again. Maybe you're different." "I hope so," Maya said. "I really hope so." As Maya drove back to Charleston the next morning, her mind was already working on implementation strategies. She thought about how portable diagnostic equipment could be housed at the fire station, how telemedicine consultations could be conducted at the library, and how community health education programs could be built around the existing informal care networks. For the first time since accepting Marcus's offer, Maya felt confident that she was exactly where she needed to be. Back at Innovate Tech, Maya threw herself into designing the Millbrook pilot program with an intensity that surprised even her. She worked late into the evenings, collaborating with engineers, reviewing medical protocols, and developing training materials that would help community members operate the new equipment safely. The biggest challenge wasn't the technology itself, but figuring out how to integrate it into Millbrook's existing social fabric. Maya had learned that successful healthcare interventions required more than just good equipment. They needed community buy-in, local leadership, and sustainable funding models. "I want to propose something unconventional," Maya announced during a team meeting with Dr. Martinez, Marcus, and the project engineers. "Instead of setting up a traditional clinic, I think we should create a distributed healthcare network using existing community spaces." "Oh, what do you mean?" asked Thomas Wu, the lead engineer on the portable diagnostics project. Maya pulled up a map of Millbrook on the conference room screen. "The fire station already serves as the emergency response center. The library is where people gather for meetings and community events. The senior center is where elderly residents spend their days. Instead of asking people to come to us, we bring healthcare to places they already trust and visit regularly." Dr. Martinez leaned forward with interest. "How would that work practically?" "We station different equipment at different locations, based on usage patterns," Maya explained. "Basic diagnostic equipment at the fire station for emergencies, telemedicine set up at the library for specialist consultations, wellness monitoring at the senior center for preventive care. We train local volunteers to operate everything and coordinate between sites." Marcus smiled. "It's like creating a virtual hospital distributed across the entire community." "Exactly. And we use existing relationships and trust networks instead of trying to build new ones from scratch." The team spent the next several weeks refining Maya's concept. Thomas worked on creating equipment packages that could be easily transported between locations. Dr. Martinez developed protocols for remote supervision of community health workers. Maya focused on identifying and training the volunteers who would make the system work. 3 months after her first visit to Millbrook, Maya returned with a small team to begin implementation. This time, she was accompanied by Thomas, a training specialist named Rachel Kim, and Linda Davis, the former nurse from Millbrook whom Maya had convinced to join Innovate Tech as a community liaison. "I still can't believe you hired me," Linda said as they drove through the familiar mountain roads. "I've been retired for 5 years." "You know this community better than anyone," Maya replied, "and residents trust you. That's worth more than any credential." The implementation began at the fire station, where Fire Chief Danny Rodriguez had volunteered his facility as the first pilot location. Maya watched as Thomas demonstrated the portable diagnostic equipment to Danny and 3 volunteer firefighters. "This device can run 23 different blood tests," Thomas explained, holding up a tablet-sized analyzer. "Results come back in 15 minutes, and they're automatically transmitted to consulting physicians for review." Danny, a 20-year veteran with graying temples and calloused hands, examined the equipment skeptically. "What happens if it breaks? We can't exactly call tech support from up here." "That's why we're training multiple people on troubleshooting," Rachel said. "Plus, the equipment is designed to be extremely durable. It can handle conditions much more challenging than what you'll encounter here." Maya appreciated Danny's practical concerns. "Chief Rodriguez, what would make you feel most confident about using this equipment?" "Honestly, knowing that someone with medical training is always available if we run into problems. My guys are good at emergencies, but we're not nurses or doctors." "That's exactly why Linda is here," Maya said. "She'll be your primary medical contact, and she'll have backup from our clinical team 24/7. Over the following weeks, the team established protocols for each location. At the library, they created a private consultation room where residents could connect with specialists via high-definition video conferencing. Librarian Susan Powell, who had a master's degree in social work, volunteered to coordinate appointments and help residents navigate the technology. "I've always thought libraries should be more than just book repositories," Susan said, as Maya tested the telemedicine setup. "This feels like a natural extension of our mission to serve the community." The senior center proved to be the most enthusiastic adoption site. Director Margaret Foster, the same woman Maya had interviewed about rationing insulin, embraced the wellness monitoring program with remarkable energy. "For years, we've watched friends get sicker and sicker because they couldn't afford regular checkups," Margaret explained as Maya demonstrated a blood pressure monitoring station. "Now we can catch problems early, right here where people feel comfortable." The breakthrough moment came 6 weeks into the pilot program. Betty Morrison, an 83-year-old widow, was having her routine wellness check at the senior center when the blood pressure monitor detected an irregular heartbeat. Linda Davis recognized the significance immediately and contacted Dr. Martinez, who arranged for an emergency cardiology consultation via telemedicine. Within an hour, Betty was speaking with Dr. Jennifer Park, a cardiologist in Charleston, who diagnosed atrial fibrillation and prescribed medication that could prevent a potentially fatal stroke. The entire consultation, from detection to treatment plan, happened without Betty having to leave Millbrook. "This is exactly what we hoped would happen," Maya told Marcus during their weekly check-in call. "We didn't just give them access to health care, we gave them access to the same quality of care available in major cities." Word of Betty's successful diagnosis spread quickly through the small community, and suddenly residents who had been skeptical about the city technology were asking when they could schedule their own appointments. However, success brought new challenges. Demand for the services quickly exceeded the capacity of the volunteer system Maya had designed. Residents wanted more appointment slots, additional specialists, and expanded equipment capabilities. "We have a good problem," Linda reported during a team meeting. "Too many people want to use the services." Maya realized they needed to scale the program, but scaling required more funding, more equipment, and more trained personnel. She found herself caught between the success of the pilot and the limitations of what they could sustainably provide. The solution came from an unexpected source. Dr. Emily Watson, a family physician who had recently completed her residency, contacted Maya after reading about the Millbrook program in a medical journal. "I'm interested in rural medicine, but I've been worried about professional isolation," Dr. Watson explained during their phone conversation. "Your model seems to solve that problem by connecting rural practitioners with urban specialists." Maya was intrigued. "What are you thinking? What if someone like me could be based in Millbrook full-time, but connected to your telemedicine network for consultation and continuing education? I could provide on-site care for routine issues and coordinate with specialists for complex cases." The idea was brilliant in its simplicity. Instead of trying to serve Millbrook remotely, they could attract young physicians to rural communities by offering them the technological support and professional development opportunities they needed. To provide excellent care, Maya presented the concept to Marcus and Dr. Martinez, who immediately saw its potential. "We're not just creating healthcare access," Marcus said excitedly. "We're creating a new model for rural medical practice that could attract the next generation of physicians to underserved areas." Within 2 months, Dr. Watson had relocated to Millbrook and established a permanent clinic using Innovate Tech's equipment and telemedicine platforms. The distributed network Maya had originally designed evolved into a hybrid model combining on-site primary care with remote specialist consultation. The transformation was remarkable. Millbrook went from having no healthcare access to having better connected medical services than some urban areas. Residents could see their local doctor for routine care, consult with specialists via video conference, and access emergency diagnostics at multiple community locations. More importantly, the model was working financially. Insurance companies were willing to reimburse for telemedicine consultations, the equipment costs were manageable, and Dr. Watson's practice was sustainable with the technology support Innovate Tech provided. "You've done something extraordinary here," Helen Murphy told Maya during her latest visit to Millbrook. "You didn't just bring us health care, you brought us hope that someone actually understands what rural communities need." As Maya walked through downtown Millbrook, she noticed changes beyond just the healthcare improvements. The senior center was busier, with residents gathering for wellness programs and health education sessions. The library had become a community technology hub, where people learned to use tablets and video conferencing for staying connected with family. Even the fire station felt more vital, serving as both emergency response center and community health resource. "What's next?" Linda asked as they sat in the fire station, watching Chief Rodriguez expertly operate the diagnostic equipment that had once seemed so foreign. Maya smiled, thinking about the stack of community profiles on her desk back. "At Innovate Tech, we take what we've learned here and figure out how to help 20 more communities just like this one." 2 years after Maya first met Marcus as a patient in Memorial General's emergency department, she found herself standing before a congressional subcommittee on healthcare access, preparing to testify about the community health initiative's impact across 15 rural communities in 12 states. The hearing room was intimidating, with its formal wood paneling and rows of senators seated behind an imposing bench. Maya had testified before state health departments and medical boards, but never at the federal level. As she adjusted the microphone and looked out at the audience, she spotted Marcus in the gallery, giving her an encouraging nod. "Ms. Rodriguez," began Senator Patricia Sullivan, the subcommittee chair, "your program has attracted significant attention from both healthcare advocates and technology companies. Can you explain in practical terms how the distributed healthcare model works?" Maya had given this explanation hundreds of times, but never to people who could influence national healthcare policy. Senator Sullivan, traditional healthcare assumes that patients will travel to centralized facilities for care. Our model reverses that assumption. We bring comprehensive healthcare capabilities directly to communities using existing infrastructure and local relationships. She clicked to her first slide, showing a map of their active sites. In Millbrook, West Virginia, we've reduced emergency room visits by 68%, while increasing preventive care screenings by over 400%. Residents who hadn't seen a doctor in years now receive regular wellness checks and specialist consultations without leaving their community. Senator James Park from California leaned forward. What about costs? Rural healthcare has traditionally been economically unsustainable. That's exactly what we've changed, Maya replied confidently. By combining telemedicine with portable diagnostics and community-based care coordination, we've reduced per-patient costs by approximately 40% compared to traditional rural clinic models. Insurance reimbursement rates actually favor our approach because we focus on prevention rather than emergency intervention. Maya advanced to a slide showing financial projections. More importantly, the economic impact extends beyond healthcare. Costs. Communities with our programs have seen increased business development, higher property values, and improved quality of life indicators that attract new residents and businesses. The questions continued for over an hour, covering everything from regulatory compliance to scalability challenges. Maya answered each one, drawing from her experience in the field, describing specific patients and community transformations that illustrated broader policy implications. Ms. Rodriguez, said Senator Maria Gonzalez from Texas, critics argue that technology-based healthcare delivery depersonalizes medicine and reduces the human connection that's essential to healing. How do you respond to that concern? Maya smiled, thinking of countless patients she'd helped through the program. Senator, I believe exactly the opposite is true. When healthcare is accessible and affordable, relationships between providers and patients actually become stronger, not weaker. Dr. Emily Watson in Millbrook knows her patients better than most urban physicians because she's not rushing through 15-minute appointments to meet productivity quotas. She clicked a photo of Dr. Watson conducting a video consultation with a patient while Linda Davis assisted. Our technology enables more time for human connection, not less. When a cardiologist in Baltimore can consult with a patient in rural Montana via video conference, supported by real-time diagnostic data and coordinated by a local care team, that patient receives more personalized attention than they would in most traditional settings. After the hearing, Maya met with Marcus for dinner at a quiet restaurant near Capitol Hill. The day had been exhausting but exhilarating, representing the culmination of 2 years of intensive work. "How do you think it went?" Marcus asked as they settled into a corner booth. "Better than I expected," Maya replied. "I think they understood that we're not just talking about technology deployment. We're talking about fundamentally reimagining how healthcare delivery works in rural America." "Any regrets about leaving nursing?" Maya considered the question seriously. "I miss direct patient care sometimes, but then I think about people like Margaret Foster, who went from rationing insulin to managing her diabetes with regular monitoring and education. Or Tom Williams, who finally got the pulmonary rehabilitation he needed after years of declining lung function. I'm still taking care of patients, just at a different scale." Marcus raised his glass. "To save lives in ways we never imagined." As they clinked glasses, Maya's phone buzzed with a text from Dr. Watson. "Betty Morrison wants you to know she's been teaching other seniors how to use the blood pressure monitors. She says you started something bigger than healthcare in Millbrook." Maya showed the message to Marcus, who grinned. "Betty's become quite the community health advocate, hasn't she?" "She's not the only one. We're seeing this pattern across all our sites. Residents become so invested in the program that they start taking leadership roles in their own community health initiatives. Their conversation was interrupted by a woman approaching their table. "Excuse me, are you Maya Rodriguez from Innovate Tech?" Maya looked up to see a woman in her 40s with kind eyes and graying hair. "Yes, I am. I'm Dr. Rachel Stevens, a family physician from Oklahoma. I've been following your work, and I'm wondering if your program might work in Native American communities. The reservation where I work has similar healthcare access challenges to the rural towns you're serving." Maya immediately thought of the Native American community profiles in her files back at Innovate Tech. "I'd love to discuss that with you. We've been researching tribal healthcare needs, but we haven't implemented any programs yet." Dr. Stevens handed Maya her business card. "The Indian Health Service is interested in innovative delivery models. I think your distributed approach could be particularly effective on reservations where distances are vast and traditional infrastructure is limited." After Dr. Stevens left, Marcus looked thoughtful. "That could be huge, Maya. Native American communities have some of the worst health outcomes in the country. I know. I've been wanting to expand into tribal healthcare, but I wanted to make sure we understood the cultural and regulatory complexities first." What would be different about working on reservations? Maya had been researching this question for months. Tribal sovereignty means different healthcare regulations, cultural considerations around traditional healing practices, trust issues based on historical exploitation by outside organizations. We'd need to approach it completely differently from our rural town model, but the core principles would be the same. Absolutely. Meet people where they are, build on existing community strengths, and create sustainable systems that serve actual needs rather than imposed solutions. Over the following months, Maya found herself traveling constantly between existing program sites, potential new communities, and Washington, D.C., where healthcare policy discussions increasingly referenced the Community Health Initiative as a model for rural healthcare reform. The program's success had attracted attention from medical schools, technology companies, and healthcare policy organizations. Maya received speaking invitations from conferences around the world, but she insisted on maintaining her connection to the communities they served. One particularly meaningful trip took her back to Memorial General Hospital, where she'd been invited to speak to the nursing staff about career development and healthcare innovation. Walking through the familiar corridors felt surreal. The emergency department looked exactly the same, but Maya felt completely transformed by her experiences of the past 2 years. Dr. Patricia Williams introduced Maya to the assembled nurses with obvious pride. 2 years ago, Maya Rodriguez was one of our most dedicated floor nurses. Today, she's leading a healthcare initiative that's changing how we think about rural medicine across the entire country. During her presentation, Maya talked about the skills that had translated from bedside nursing to healthcare innovation: patient advocacy, systems thinking, cultural sensitivity, and the ability to see problems from multiple perspectives. "The most important thing I learned as a nurse," Maya told the group, "was that healing happens in relationships, not just in procedures. That principle guides everything we do in the Community Health Initiative." A young nurse named Jennifer raised her hand. "Do you miss being at the bedside?" "Every day," Maya admitted. "But I've realized that bedside care isn't the only way to heal people. When we create systems that give a diabetic grandmother access to regular monitoring and education, when we connect a farmer with chronic pain to a pain management specialist, when we help a community take ownership of their own health outcomes, that's healing too. After the presentation, Maya visited the trauma bay where she'd first met Marcus. The same monitors beeped, the same fluorescent lights hummed overhead, and the same sense of controlled urgency filled the air. But standing there, Maya realized how much her perspective on healthcare had expanded. Her phone rang, Marcus calling with news about funding approval for their tribal healthcare pilot program. The Indian Health Service just approved our proposal. For 3 reservation sites, Marcus said excitedly, and Dr. Stevens wants to lead the implementation team. Maya stepped out of the trauma bay and into the hospital corridor, watching nurses and doctors hurry past on their missions of healing. When do we start? Next month. Are you ready for the next challenge? Maya thought about Betty Morrison teaching blood pressure monitoring to her senior center friends, about Dr. Watson building her practice in a community that had given up hope, about the congressional testimony that might influence policy for millions of rural Americans. I'm ready, she said. Let's go change some more lives. As Maya left Memorial General that evening, she passed the emergency department where everything had started. The ambulance bay was quiet, but she knew that somewhere in those rooms, nurses were making the same kind of life-or-death decisions she'd made the night she met Marcus. The difference was that now she understood healing could happen at multiple levels, in individual moments of care, in community-wide systems change, and in policy decisions that affected entire populations. Her journey from exhausted nurse to healthcare innovator had taught her that sometimes the most important thing you can do for patients is to step back and ask bigger questions about the systems meant to serve them. 6 months later, Maya stood in a community center on the Lakota Reservation in South Dakota, watching Dr. Stevens and tribal health workers conduct the first telemedicine consultation with a pediatric specialist in Minneapolis. A young mother named Sarah Crow. Heather was getting answers about her son's chronic asthma that she'd been seeking for over a year. The nearest pediatric pulmonologist is 6 hours away, Sarah explained to the specialist via video conference. We've been managing his symptoms, but I've been worried we're missing something important. As Maya watched the consultation unfold, the tribal health worker conducting breathing tests, the specialist reviewing real-time data and providing treatment recommendations, the mother finally getting the specialized care her child needed. She thought about the accident that had brought her and Marcus together. That night in the emergency department, she'd saved one life through her clinical skills and dedication. But the relationship that grew from that moment had enabled her to impact thousands of lives through systems change and innovation. Maya's phone buzzed with a text from Marcus. Saw the news coverage of today's launch. Your grandmother would be so proud, she smiled, remembering her mother's struggle with cancer and the bills that had changed the trajectory of her education. Her mother had never lived to see Maya become a nurse, let alone a healthcare innovator. But somehow, Maya felt certain that this work, helping people access the care they deserved, regardless of where they lived or how much money they had, was exactly what her mother would have wanted her to do. As the sun set over the South Dakota plains, Maya Rodriguez realized that sometimes the most unexpected encounters lead to the most meaningful destinations. A motorcycle accident, a dedicated nurse, and a tech billionaire who chose to see opportunity in crisis had combined to create something none of them could have imagined alone. The work was far from over. There were communities still waiting for access, policies still needing reform, and innovations still waiting to be developed. But for the first time since that exhausting double shift 2 years ago, Maya felt like she was exactly where she belonged, at the intersection of technology and compassion, building bridges between people who had resources and people who needed them, proving that sometimes the best way to heal the world is one community at a time. 3 years after the Lakota Reservation launch, Maya found herself facing an entirely new challenge, The community health initiative had grown beyond anything she or Marcus had originally envisioned, operating in 47 communities across 18 states. Success had brought visibility, and visibility had attracted competitors, some with genuine intentions to help underserved populations, others more interested in capitalizing on the lucrative government contracts that rural healthcare innovation was now generating. "We have a problem," Dr. Martinez announced during their quarterly leadership meeting. The conference room overlooked downtown Seattle, where Innovate Tech had moved their headquarters to be closer to major technology talent pools. 3 different companies are claiming they invented our distributed healthcare model, and they're underbidding us on new contracts by promising unrealistic cost savings. Maya studied the competitive analysis spread across the table. Companies with names like Rural Tech Solutions and Community Care Innovations were offering services that looked similar to theirs on paper, but lacked the community engagement and clinical expertise that made their programs actually work. "Let them," Maya said, surprising everyone in the room. "Imitation is flattery, and if other companies can genuinely help underserved communities, that's good for everyone." Marcus raised an eyebrow. "You're not concerned about losing market share." "I'm concerned about communities getting poor-quality knockoffs that promise transformation but deliver disappointment," Maya replied. "That damages trust for everyone working in this space." Dr. Stevens, who had become Maya's deputy director after the success of the tribal healthcare programs, leaned forward. "What are you thinking?" Maya had been wrestling with this issue for weeks. "I think we need to shift our focus from competing on contracts to building capacity for authentic community health transformation. Instead of just implementing our model, we should be training other organizations to do this work properly." The idea was controversial within Innovate Tech's business development team, who worried about giving away competitive advantages. But Maya argued that their real advantage wasn't proprietary technology. It was the deep understanding of how to build trust with communities and create sustainable healthcare systems that actually served people's needs. Over the following year, Maya developed the Community Health Leadership Institute, a comprehensive training program for healthcare professionals, technology companies, and community organizations interested in rural healthcare innovation. The 6-month program combined classroom learning with hands-on fieldwork in established community health initiative sites. The first cohort included Dr. Amanda Torres, an emergency physician from Phoenix who wanted to bring better trauma care to remote Arizona communities. James Washington, a former Peace Corps volunteer interested in adapting their model for international development. And surprisingly, Dr. Lisa Park, the cardiologist who had diagnosed Betty Morrison's atrial fibrillation during that first breakthrough telemedicine consultation in Millbrook. "I've been thinking about this interaction for 3 years, Dr. Park told Maya during the program's opening session. That consultation with Betty Morrison was more satisfying than most of my in-person appointments because I knew I was solving a real problem for someone who had no other options. I want to do more of that work." Maya found teaching to be energizing in ways she hadn't expected. Working with passionate professionals who shared her commitment to healthcare equity reminded her of why she'd originally been drawn to nursing. The Institute participants brought diverse perspectives that enriched her own understanding of the challenges and opportunities in community health. One particularly impactful moment came during Dr. Torres's field rotation in rural Montana. She was shadowing Dr. Patricia Kim, a program physician who had established a clinic serving 3 communities across a 100-mile radius. During a routine wellness visit, Dr. Kim identified early signs of Parkinson's disease in a 68-year-old rancher named Bill Rodriguez. In a traditional rural setting, Bill might not have been diagnosed for another year or 2, Dr. Torres observed during her reflection session with Maya. But because Dr. Kim has access to neurological consultants through telemedicine and can perform sophisticated diagnostic tests on site, Bill can start treatment immediately. What struck you most about that interaction? Maya asked. The integration, Dr. Torres replied thoughtfully. Dr. Kim wasn't just using technology to replace urban healthcare. She was creating something new that was actually better adapted to rural life. Bill didn't have to take time off work for multiple specialist appointments or travel hundreds of miles for follow-up care. The technology enabled Dr. Kim to provide more comprehensive care, not just more convenient care. These insights from Institute participants helped Maya refine their model and identify new opportunities for innovation. Dr. Washington's international perspective led to pilot programs adapting their approach for remote communities in Guatemala and Kenya. Dr. Park's cardiology expertise resulted in specialized protocols for managing complex cardiovascular conditions in rural settings. Meanwhile, the original communities continued to evolve in unexpected ways. Millbrook had become something of a healthcare tourism destination, with delegations from around the world visiting to observe their distributed care model. Helen Murphy, now in her 70s, had become an unofficial ambassador for the program, hosting international visitors at her bed and breakfast and explaining how the technology had transformed community life. People come here expecting to see fancy equipment, Helen told Maya during one of her regular visits. But what they really discover is that healthcare isn't about the machines. It's about the relationships and systems that make the machines useful. The most significant evolution came when several program communities began collaborating with each other to share resources and expertise. Dr. Watson in Millbrook started conducting telemedicine consultations for patients in other rural communities that didn't have full-time physicians. Community health workers from different sites began sharing best practices and troubleshooting challenges together. Maya realized they had accidentally created something much larger than a healthcare delivery system. They had built a network of rural communities that were supporting each other's health and well-being in ways that transcended traditional geographical and organizational boundaries. This network approach caught the attention of federal health officials who were struggling with healthcare workforce shortages and rising costs. Maya found herself appointed to a national advisory committee on rural health innovation, working alongside policy experts and academic researchers to develop recommendations for healthcare reform. The committee's work culminated in the Rural Health Transformation Act, a bipartisan piece of legislation that provided federal funding for community-based healthcare innovation and established new reimbursement models that favored preventive care and care coordination over traditional fee-for-service approaches. During the bill signing ceremony at the White House, Maya stood beside other healthcare advocates as the president praised their work in developing practical solutions that put patients and communities first. As cameras flashed and officials made speeches about healthcare innovation, Maya thought about Betty Morrison, still teaching blood pressure monitoring to seniors in Millbrook, and Dr. Watson, now mentoring young physicians interested in rural practice through the Leadership Institute. The ceremony concluded with a reception where Maya found herself in conversation with the Secretary of Health and Human Services about the global implications of their work. Countries around the world are watching what you've accomplished, the Secretary told her. The World Health Organization is interested in adapting your model for rural communities in developing nations. That evening, Maya called Marcus from her hotel room in Washington. Did you ever imagine, when you were lying in that hospital bed, that we'd end up influencing international health policy? Marcus laughed. Honestly, I was just hoping to survive the night. But looking back, I think everything happened exactly as it was supposed to. Do you really believe that the accident was somehow meant to happen? I believe that when two people who care about making the world better find each other, extraordinary things become possible. The accident was random, but what we chose to do afterward, that was intentional. Maya walked to her hotel window, looking out at the illuminated monuments and government buildings that housed the machinery of American democracy. Somewhere in those buildings, legislation was being written that would affect healthcare access for millions of people, influenced by lessons learned in a small West Virginia town by a nurse who had refused to leave a patient's bedside. "Marcus, I need to tell you something I've never said properly." "What's that?" "Thank you. Not just for the job opportunity, but for seeing something in me that I didn't see in myself, for believing that a floor nurse could help transform healthcare delivery, for trusting me with resources and responsibility that changed not just my life, but the lives of thousands of other people. Maya, you saved my life. I just tried to return the favor by helping you save other lives. Besides, you're the one who did all the hard work." As Maya prepared for bed that night, she reflected on the journey that had brought her from Memorial General's emergency department to the corridors of power in Washington, D.C. The exhausted nurse who had worked a double shift to help a stranger had become a nationally recognized expert in healthcare innovation. But the core motivation remained the same: ensuring that everyone had access to the care they needed to live healthy, productive lives. Her phone buzzed with a text from Linda Davis, now the Director of Community Engagement for the entire community. "Health Initiative. Saw you on the news tonight. Millbrook is throwing a celebration party for our favorite healthcare revolutionary. You better get back here soon." Maya smiled, thinking about the community that had taught her so much about the power of local relationships and collective action. Tomorrow, she would fly back to West Virginia for the celebration, but next week she would be in Kenya, helping Dr. Washington establish the first international community health initiative site. The work continued to expand and evolve, but its foundation remained the simple truth Maya had learned that night in the emergency department. Healing happens when people care enough to stay present during difficult moments and work together to create solutions that serve everyone's needs. 5 years after that motorcycle accident changed both their lives, Maya Rodriguez and Marcus Chen had proven that sometimes the most important encounters happen when we least expect them, and the most meaningful work emerges from our willingness to see opportunity in crisis and possibility in unexpected partnerships. Up next, you've got 2 more standout stories right on your screen. If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.